Welcome to this educational recording on the topic of applying Plan, Do, Study, Act cycles to improve fall risk screening. The Catch Rural Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch Rural Falls program is led by myself, Vicki Kennel, and my colleague Dawn Venema. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement and organizational science. Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this recording are to describe the intended purpose of Plan, Do, Study, Act, or PDSA cycles, describe each element of a PDSA cycle, and apply the PDSA approach to improve fall risk screening in your clinic. We discussed the three fundamental questions within the model for improvement in a previous presentation. Once you have identified specific testable change ideas, the next thing to do is to test these changes. In this presentation, we will focus on the Plan, Do, Study, Act cycle as a method to study and learn how the change works in your own local clinic environment. The Plan, Do, Study, Act cycle is a cycle for learning and improvement that can and should be repeated multiple times. This cycle promotes a trial and learning approach to improvement efforts by planning for, testing out, studying results, and taking action on what you learned to develop knowledge over time about how a change may result in improvement. Planning includes planning the test of change and a plan for collecting data. We specify the question that we want to answer in this PDSA cycle, our hypothesis about what we think will happen, develop a clear plan to test the change, and identify the data that we need to collect. Do is where we run the test on a small scale. We carry out the test, document problems and unexpected observations, and collect and begin to analyze the data that we have collected. Study is where we analyze the results and compare them to our question and predictions. We complete the analysis of our data that we collected, compare the data to our hypothesis, and summarize and reflect on what we learned in this test cycle. Finally, Act is where, based on what we learned from this test of change, we make a plan for our next step or our next PDSA cycle. We might adapt, so make modifications to our changes, our approach, etc., and then run another test. We might adopt, test the change on a larger scale, or perhaps we might even abandon this so we don't do another test on this change idea. We also prepare a plan for the next PDSA cycle if relevant. We will walk through each step of the PDSA cycle using an example of one cycle that could be used in fall risk screening improvement efforts. So what does the planning stage entail? The P of the PDSA cycle stands for plan. It could also just as easily stand for predict. The key to the successful use of the PDSA approach is to ensure that each test cycle includes a clearly stated prediction, followed by a test of change to answer the question posed in the planning phase. We'll follow through an example of one PDSA cycle that could be used to test a change to improve fall risk screening practices in a clinic. So in this example, the question that this clinic wants to answer is, will our clinic increase fall risk screening completion rates for our adult patients ages 65 and older? The group's prediction is that their screening completion rates will increase from 50% to 75% over the next 2 weeks. Staff will identify successes and barriers to completing fall risk screening that will be addressed in the next test of change. So what's the plan? For this particular clinic, during their next 2 weeks, all of their patients ages 65 and older who hadn't completed a fall risk screening within the past 6 months are going to be offered the CDC studies Stay Independent 12-question fall risk screening during their appointment. Medical assistants and nurses were given in-person training and written instructions for how to distribute the screening tool to their patients, how to educate patients about the purpose of the screening, and how to assist them with completing the screening tool if needed. This particular clinic wanted to trial out and see if this process works well if patients complete the Stay Independent screening tool in the appointment room after completing vitals, but prior to their visit with their provider. So that's the focus for this particular test of change. The data that this clinic wants to collect is to be able to calculate rates of fall risk screening for their eligible patients. They want to collect data from their medical record of all patients aged 65 and older during this 2-week trial time frame. They need to determine which of those patients do and do not have a stay-independent fall risk screening result documented in the EMR. The completion rate will be determined by those who have a fully completed stay-independent screening documented in the EMR, divided by all patients ages 65 and older seen in the clinic. Medical assistants and nursing staff are also going to document their experience and observations of the current process for administering the stay independent screening tool, but will do so in a separate document. On this particular site, we'll offer you a checklist that can be helpful for informing what should be included in a broader plan for a specific test of change. I won't go through these things in detail, as you could read these on this slide, but the important takeaway point here is that a lot of effort should go into thinking carefully about what needs to be included in this test of change and incorporated into your broader plan. So the planning stage is a really critical and an important piece to set you up for success for the remaining stages of the PDSA cycle. Next, we'll move on to the D, which is the do phase. So what does the do phase entail? So in the do phase of the PDSA cycle, we do the work. So we implement the tests that we planned and we collect the data that we propose to collect to help us answer the questions that we generated in the plan phase for comparison to those predictions that we made about what we think might happen during this particular test of a change. So in the data collection phase, we also want to collect data about any problems that might have come up during this test of change, any unexpected things that happened, so unusual cases or something in the environment that maybe affected the test of change. This could also be something that worked exceptionally well that we didn't expect. So don't undervalue documenting these types of observations. Like, this type of information is really helpful for learning and to help put your analysis of the data in the study phase into context in terms of what happened during your do or your testing phase. So what we collect in the do phase should ultimately help prepare for learning in the study phase. A few key points to help reinforce data collection efforts during the do phase. Consider how you're going to collect your data. So is this on a form that exists already? Do you need to create some sort of form? Does the data exist perhaps already in your electronic medical record? Ensure that those who are collecting the data have clear and consistent instructions. So this is especially important when people involved in the test are helping you to document and collect the data. So for example, if you're asking staff to document like a start time or an end time or what their experiences are like with a new process. We don't want to necessarily assume that people know what to do and that they will do it exactly how you want without clear instructions. So make sure that any training you provide on the data collection for a PDSA cycle includes the why. So why are you collecting the data and why that data is important? You also want to prepare to collect data that will inform you about some of these problems or unexpected occurrences during that test of change during the do portion of the cycle. This type of information can really help to promote learning about many of the implementation related aspects of the change. So let's talk about go back to our fall risk screening example for this clinic that's working on testing out a trial run of their new process for screening older adults. So in this example, the plan was initiated, and for 2 weeks, the clinic decided to run a trial of having their patients ages 65 and older complete that stay independent screening tool upon completion of vitals. So a week into their test, they solicited some feedback from staff. Staff were anecdotally reporting that overall the providers were pretty happy with the depth of information that was available to them on the screening tool. Some patients had skipped answering a few of the questions on the screening tool, and it wasn't clear yet to the staff if they just ran out of time before the provider entered the room or if they chose not to answer those questions. 2 patients requested help completing the screening tool, and 1 declined to complete the screening tool altogether. So staff were encouraged to continue to document their experiences and observations. And after this 2-week trial is complete, the team pulled data from the medical record for analysis, and they also compiled some of the experiences and observations that were documented by the staff. Next, we'll move on to the study phase. So what does a study phase entail? In the study phase, this is really where we analyze the data. So we analyze everything we collected and what we learned from the do phase of our PDSA cycle. So in the do phase, we implemented the test that we planned. We collected the data we proposed to collect to help us answer the questions that we generated in the plan phase for comparison to those predictions that we made about what we think might happen during this particular test of change. So in the study phase, we take that data that we collected and we analyze it so we can compare what the data tells us about the test of change with those predictions that we originally made during the plan phase. So this step of the PDSA cycle is kind of analogous to the idea of conducting analysis and interpretation of results in scientific methodology. So keep in mind that a key element of the PDSA approach is to make rapid cycle changes, and our ability to do this depends upon how well we articulate a focused prediction and collect just enough data to test it. So in the study phase, we examine the results of our test of change and we look at them from the lens of what did we learn from this particular test of change. Recall that in the do phase, you're also encouraged to collect that data about any problems or issues that came up during this test of change. And that data should be reviewed and considered in light of your analysis of the data. So back to our follower screening example, the team did their analysis and it revealed that the stay independent screening tool completion rate increased from 50% to 65%. So they didn't quite meet their initial goal for this test of change, but they did see some improvement in the completion of that stay independent screening over time. The staff met again to talk about the improvement they observed, some successes and barriers, and to brainstorm what their next steps might be. As they talked about this test of the process of having patients complete the screening tool after completing vitals, a few things were revealed to the team. One is that they thought that patient education on completing the screening tool really needed to make sure they reinforced completing all 12 questions on the screening tool for it to be considered complete. In most cases, the patients had just enough time to complete the screening tool before the provider entered the room, but thought that this is something that the team could explore further later on. They also thought that there could be time for patients to complete that screening tool in the waiting room, given the typical average patient wait time in the waiting room, should the team decide that they want to change their process and test out how this works in kind of by doing that screening in a different stage of the patient's visit. And then finally, we move to the A, which is the ACT phase. So in the ACT phase of the PDSA cycle, we take what we've learned from our study of the test of change, and then we use that information to inform a direction and a plan for the next step. So essentially, what's our next course of action? So based on what we learned, we might decide to make adaptations. So we want to modify something, whether it's the change we tested, maybe it's the way we frame the problem, or the specific sample, or maybe conditions under which we want to test that change, and then run another test. We might just decide to adopt it. So this was really successful and we want to test the same change, but we want to do it on a larger scale. So with a bigger sample of patients or over a longer time frame. We may also decide to completely abandon this. So we don't want to conduct another test on this change idea. And maybe we're going to go back to the drawing board or in the project without investing any further effort. So we then proceed to start thinking about our plan for the next PDSA cycle. So the ACT component is a really essential kind of final step of the PDSA method, because here we take the knowledge that we gained from this test of change and then we translate it into some sort of action moving forward. So it really kind of serves as like the glue, so to speak, of this sequential building of knowledge with multiple PDSA test cycles. So back to our follower screening example, the team decides to make some adaptations to their plan moving forward. So one simple thing that the clinic wanted to test was to see, if we augment our patient education about completing the stay independent screening tool to make sure we're really reinforcing completing all 12 questions on the screening tool, they thought that might be a small change that they could test out in the next cycle. And the staff suggested that creating a script for that type of education might be helpful. The clinic ultimately decided to keep the same process for now. So after completion of vitals, patients are going to complete the screening tool in that appointment room prior to their visit with the provider, just to see if in a short time frame, if this change in patient education helps to increase screening completion rates. If not, then they were open to revisiting a possible change in the timing of completing the stay independent screening in a third test of change. So as we've talked about in this presentation, the PDSA approach it's not intended to be like a one and done approach to improvement. So the purpose of this method is in multiple tests of change that help us to build knowledge and understanding and to learn as quickly as possible whether a change is going to work in a specific setting, and then make some adjustments as we need to to increase the chances of successfully implementing and sustaining some desired improvements. So the lessons that we learn from one cycle really link together and then help to inform the next cycle and subsequent cycles that follow. So with this in mind, we can really use the PDSA approach to support scaling up changes and interventions from small scale tests of change to wider scale tests of change into implementation. So here we have an example of just like kind of the start of what a couple of different PDSA cycles could look like from our fall risk screening example. I won't go through these in detail because you can see this on the presentation slide in the handout. But ultimately, what was learned from the first test of change informed the plan for the second cycle. What was learned in the second cycle started to inform the plan for the third cycle, et cetera, et cetera. A couple of things to keep in mind when using the PDSA approach. Again, this idea that they're not intended to be a one and done situation. So we use this methodology with the intention that we're going to run multiple cycles to gather information and really inform how much this change is affecting what we hope to see is improvement, and to use data to help inform what some of those next steps might be for changes for improvement. We want to start with small scale tests of change with a series of follow-up tests before we start to make changes on a larger scale. Including a variety of measures is really critical to help evaluate the changes and how things are going with implementation. And it's also important through this process to make sure that we're documenting like what are some of the implementation barriers we might be encountering, because we can try to remove some of those and test out the effects of that in subsequent PDSA cycles. And again, refinement is expected over time. This is really like a trial by learning process and method for improvement. So in summary, we can use guidance from the model for improvement and the PDSA method to help guide and inform our improvement efforts to improve fall risk screening. Creating a clear and a focused plan for each of your small tests of change is really helpful and important to get you started. Be really clear on the questions that you're trying to answer in each test of change, because that's going to help inform the data that you need to collect within each test of change. And then finally, reinforcing that this is an iterative process to help you support the implementation of change over time. Finally, I'm going to leave you with a link to a tool that you can download from the Institute for Healthcare Improvement to support the development of PDSA cycles. To access these materials, you simply need to visit the link online, and then the IHI asks for your name, your organization, and your email in order to download the materials. So thank you for listening to this presentation on applying the Plan, Do, Study, Act cycle to improve fall risk screening.